Okay, Grand Chief, can you talk a little bit about the first 6 months of the pandemic?
The first 6 months, our First Nations were COVID free. And the first case in Northern Manitoba was detected in late September. And those were in Tatasquiac and York Factory. And 1 year into the pandemic, we have witnessed multiple MKO First Nations successfully respond to the outbreaks of COVID-19 in their First Nations. So again, I commend the leadership for their strength and devotion to keeping their communities safe. Many leaders have worked 24/7 and under a lot of stress to contain the virus. And I'm so proud of the leadership that we have. They have courage and they have a lot of energy, and they continue to lead our people and they continue to lead their First Nations. So I also want to give an encouragement to our leaders that they take care of themselves mentally and emotionally and physically, because we do need them. So we encourage them to take some time for themselves as well.
Okay, so I know that a lot of negative things have happened in the last year, and I think that a lot of people will be feeling like a lot of grief as we mark the first year of the pandemic. So I'm just wondering if you can reflect a little bit on that.
No doubt, in any battle there's casualties, and we have witnessed casualties. We have seen family members die because of COVID. We have seen people we know succumb to the impacts and effects of COVID-19, and even our organization had a huge loss when we lost my assistant, Clyde Flett. So we have all felt that impact very personally and directly. But the positives, I think that we can move forward knowing that our leadership has been very strong. Unprecedented times that we were living in, and our leaders exerted their leadership roles in unprecedented manners. So I'm thankful that we have such courage in our leadership, because then we're there to support them, but it's the leaders in their community that have done this work. It's the chiefs that have done the work with their pandemic response teams and their frontline workers. So I say that it has made us stronger. It has made us more resilient as a people. We stepped up to the challenge. Our First Nation experts emerged to address this pandemic with us. We have First Nation doctors that were having a lead role in discussions and decisions being made as far as supports were concerned. And one of the things that we advocated, our chiefs advocated for the inclusion of First Nation experts in the distribution of the vaccine rollout. We were at that table, and I think that has made a huge difference, because our leaders have emerged. Our frontline workers are so competent, and we never question their expertise because we see it. We see the results of their hard work and labor. And I'm thankful that the Indigenous people have emerged in a very powerful way to address this very serious crisis that we've had to face. And they did it unwaveringly. They did not back down, and they took the challenge. And they're the key to bringing our people out of this pandemic. And they have done it, and we commend them.
Okay, thank you. I know that you've relied on a lot of different leaders throughout the pandemic to provide you with advice on moving forward in a good way, and I'm wondering if you just want to recognize some of those people.
We have so many people to thank for supporting our First Nations, and our colleagues at AMC, our colleagues at SCO, and FINISM, the First Nations Health and Social Secretariat. But mostly for us at MKO, our organization was created Kiwitno Ininu Minoyawan. We owe so much to this team, because their ability to navigate through this pandemic and giving us the top level medical advice and most current information has been very critical for us in supporting our leadership in their First Nations. And Kiwitnook Ininu Minoyawin, the Northern Health Entity, was only established a year ago, and they were faced with this challenge, and yet they rose to the occasion and confronted COVID in the face, and as a result, we're moving our people forward, and that entire team rose to the challenge, supporting our chiefs and our First Nations. And I also want to acknowledge Sharon McKay, who was there at the beginning. She was instrumental in getting it off the ground and working with Barry LaValle and taking on the role of CEO. So this organization faced this worldwide pandemic with tact and professionalism that is equal to any organization in Canada. So I'm very proud. And of course, we have to thank Dr. Rusin, who has worked very closely with Kim, and such strong Indigenous leadership surrounding us to help us and to support us, and having key people in place like Dr. LaValle and our director from MKO, Kelvin Linkslake, has been very key in allowing the financial aspect of the support to flow through to our First Nations, and all our staff at MKO and at Kim. Like, I owe so much to them. They do all the work. They do all the groundwork, and we just reach out to governments, and they continue to work with us. And there's so many organizations that helped us, and ISK has been very good to us. FNIB has been very good to us, and the Red Cross and the Canadian Armed Forces have gone to our communities, giving much needed support to our chiefs, and I appreciate that very much. And the Public Health Agency of Canada has worked with the people off reserve, and so I'm thankful for all the people that have helped us and supported our First Nations, and we did it together. We're not out of the woods yet, but I see that there's hope on the horizon, because the vaccines are not being distributed in our First Nations, and we encourage people to take the vaccine, because the vaccine will bring health and safety to our people, so that one day we can continue to gather like we once did and join our families and our friends in a safe way, and just to embrace one another, because I think we all miss that. We all need that, and I'm glad we're able to do it, and I look forward to that. So, but I thank the people that helped us this far, and we still have a bit to go, a little ways to go, but I think that for the most part, there's hope on the horizon.
Okay, thank you for sharing. Do you have anything else you would like to add?
I think that there's an opportunity for us to change the status quo. COVID has shed light on the gaps that exist, and they have existed for a long time. The inequity, the inadequate services in First Nations. We've shed the light on that. And I think this is an opportunity to have a major change in policy that restricts our First Nations from acquiring and accessing quality health care for our people. The system is detrimental to our people for the most part, because there's colonial regimes and undertones in everything that exists governmentally, and we need to rid ourselves of that. And I think a lot of that is control. We need to get rid of the bureaucracy that hinders health care from being delivered to our First Nations. There's no need for people to travel to Dooley to Thompson and a 15-hour bus ride to Winnipeg, and spending 4 hours on a phone to try to access the receiving home, and then going to see a doctor for 5-10 minutes and then going home in the same way. That is an outmoded policy, And I think that it's disrespectful to our people, and that has to stop. That will be fixed. It will be fixed, and it's long overdue. So there's a lot of gaps in our healthcare system, and why should we come to the south? Why don't we have the facilities in the north, the diagnostic equipment in the north? Like, this is not rocket science. The amount of money it takes to transport our people to the south is gargantuan. It is massive. Why not invest that in facilities in the north? Why not do that for the north so we don't have to risk our lives traveling on buses that are unsafe? Sometimes the planes can be unsafe too. So why do we put our people at risk trying to get them healthy? Let's rethink this. Let's reset this. The time is now.